So it looks like patient responsibility is going to continue to increase. Kevin, the quote that you said that they see it high deductibles as bad debt really tells a pretty important story, I think, which is we talked before about how they need to find ways to reduce cost and make it more retail and utilize what they have. If there's a dollar of revenue that's being seen as bad debt before it's billed, that is really fascinating to me. And I think it's something we could probably help with here. Have you guys seen or heard of anything to help these folks not see it as, hey, this is new bad debt coming into my hospital today because they're carrying a high deductible insurance card?
I'll just speak globally. I have a hard time pointing to very specific programs or things like that. But I think, again, one of those silver linings, if you will, with COVID is, and maybe even going back to like 2008, 2009, when liquidity was so important, like every dollar is a little bit more precious these days than it used to be. I mean, this, again, it's a low margin business. It's never been a high margin business. But I think the reality is that certainly with COVID, we as an industry have watched revenues get turned off, literally. 2 years ago, everyone was ordered, basically stop doing elective, non-emergent procedures. The top line revenues dropped on average about 40% across the board for a period of time. And that wasn't baked into the budget. That wasn't planned for. And so every dollar is a little bit more precious. Those regulations got lifted, but then reality during those squeezes that I mentioned puts you right back in the same place. So again, every dollar is just a little bit more important than it used to be. So why not focus in on it unabashedly? I provided a service. I expect to get reimbursed for that service. And yes, I'm a not-for-profit, but I always tell people, look, not-for-profit, that doesn't mean you can't make a profit. It just means you don't take it home with you personally, right? It has to stay within the company and not get distributed out. So if you need to work with someone longer and focus on that, pre-collections and back office, do it and don't be embarrassed about it or ashamed about it. Years and years ago, I was on a consulting project where I sat and I watched people at the cashier office, and they were so lovely to not force their patients to cough up any money. That they'd be on a phone and have a nice watch on and doing this and putting the change back in their pocket from the gift shop kind of thing, and they get to the counter and they say it's $20 for your copay. Yeah, I don't have that. And they go, okay, that's fine. They just write it off because they just felt bad about asking for the money. And it's like, guy's holding $1,000 phone. He's got a $500 watch on. He just put $20 back in his. He's got the money. Ask for it. It's okay. Even if you ask for $1, $2, $3, something like that, it helps defray those costs. So I think we have to realize that that's our dollar. We provided a service for it. We want it. And don't be embarrassed to ask about it. So those are kind of the quick things that I see.
Not only is that dollar important, that dollar is the margin these days, right? And I mean, if you're not collecting from your patients, you're not going to hit those margin targets that you need in order to reinvest back into your facility.
Very true.
And if you can't reinvest back into your facility, then you're not going to be able to attract the providers that you want to attract to be able to provide the services that, again, to reinvest back into your facility, which at the end of the day, these not-for-profit hospitals are in many instances, the largest employers in their communities. And when they don't do well and they close, communities literally die, right? The communities die. And you're not able to attract new businesses. You're not able to attract new residents. And it just becomes a downward cycle. So the health of hospitals is extremely important. And I think you're going to continue to see additional mergers and acquisitions for organizations to try to gain strength and to be able to gain economies of scale and to reduce some of the back office costs that exist in having to have compliance departments and legal departments and IT departments, et cetera. And I think that is a trend that is going to absolutely continue because you're not going to be able to make it out there as a standalone facility or even as a few hospital facility anymore. You just don't have it.
Brian, I think that's a good point. And it's so interesting how all of this is just part of the same onion that you peel back, right? The patient has to pay to have the margin. The community benefits by the health system being there. The community is negatively affected if the health system isn't doing well. The community is negatively affected if they're outsourcing. Like you said, most of these places are huge employers in the region. So what can you do to build up the strength of the community? That's one of the things I love about Epic River is it's connecting community financial institutions with community health systems, benefiting the community, benefiting the patient, and everyone really thrives. It's just a great model. So not to be on the soapbox for Epic River, I'm not an employee. I just like the model.
Well, I think that's it for today. I do appreciate that, Heather. We've seen a lot of what you guys are talking about, which is you have individuals' personal financial position being strained, and then healthcare is one of those things that you don't get to decide when you're going to need it. And so they sign up for high deductibles. They're in a strained cash position, and everybody signs up for that high deductible, assuming they're never going to have to pay it. And so when it hits, they're just simply not prepared for it. And then when they can't make those payments and that margin goes away, now the healthcare provider in the next year is simply going to have to charge a little more to cover the losses from the previous year. So it is a pretty vicious cycle that's hard to get out of without coming up with new ways and innovative ways to approach it. When it comes to things coming back and getting these high margin procedures back after the current swoon we're having, what are some things that healthcare providers and revenue cycle groups in particular could or should be doing to prepare themselves for it? You know, if there's been some outsourcing, there's some new technology, there's some cost cutting, you've got all these things at play. You know, where do you guys see, you know, the priority landing? What are the top things to do?
And this is purely anecdotal from just talking with colleagues across the country from different provider organizations, large, small, for-profit, not-for-profit, rural, academic, you name it. The ones with the strongest cultures have been able to sustain this the best. The organizations that are top-down decision makers, where they're reactive, where they don't invest in their team members or their employees or their caregivers, whatever you want to call them, who did layoffs immediately back when the pandemic started, they're the ones who are having the hardest time, because what they've done is they've broken the trust with their teams, and they are struggling now to be able to get the resources back. And I think what it's going to take is a real focus on leadership and to invest back into really building the community back within that health system or hospital or provider or office. And I think that's going to be the number one thing that they're going to have to do, because otherwise they're not going to be able to attract the talent, and they're going to have to pay the rates that Kevin was mentioned earlier. And you're not seeing that at organizations that really stuck with their people and had very strong cultures through this pandemic.
I totally agree with that. It's one of the things I really love about not-for-profit healthcare is, you know, they don't think quarter to quarter. They think, you know, generation to generation. It's one of the beauties of it. And look, we did see a lot of knee-jerk reactions from organizations that didn't have a choice. But those organizations that had a choice will look you in the eye and say, I'm going to have a terrible quarter because I chose not to lay people off, even though my margins were down 40% for those 2 or 3 months that I suffered them, because I can. That's why I have a good, strong balance sheet. That's going to give me time to move through this period of dislocation. So I think culture is a huge piece of it. I think the other piece that we didn't mention yet, and again, another one of those very hard to find silver linings, is the relationship with your physicians. And so, look, Bren's right. Revenues are usually very easily predictable. And even though there's been a lot of noise lately, I still say they're more easily predictable than expenses are, quite frankly. So you go to your doctors and say, we're still the place you know, we're still the place you love, the place you want to admit to. We treat you right. We did treat you right during the pandemic. You know, make sure when the volume comes back, we're still with you. And how can we work with you to make that happen? And then you got to focus on those expenses. So, you know, the difficulty not-for-profits have is they can't increase revenues quickly. All right. You're in a contract, or you get Medicare, you get Medicaid or self-pay. Those rates are fixed, you know, and sometimes without your negotiation with Medicare or Medicaid, it just is what it is, You can't just say, I want 20% more, 50%. It doesn't happen. The other way you can do it is say, well, I'm just going to increase my volumes. You can do that, but not easy, not fast. You have to lure more doctors and steal that volume. So the one thing you really, if you will, can control is those expenses. 50% of your expenses is labor. Another 20 to 25% is your supplies and your drugs. So that's where you focus. The old Bonnie and Clyde thing. You rob banks because that's where the money is. You focus on labor and you focus on supplies because that's where basically 70 to 75% of your expenses are. Work on those contracts. Work on those relationships with your nurses. Make it the place to work. The hospital with a heart, so to speak. So that if you have a choice between leaving and joining a traveler agency or something like that, you say, no, I like it here. They treat me great here. This is where I want to be. And the underlying thing we haven't said even yet is the quality as well too. Doctors, nurses in particular, boy, they go where the high quality is. it's hard to price that, but we all know it. And you have a high quality organization. It attracts the best of the best. It also attracts the patients. So focus on those. I'm going to call them intangibles, but they're very tangible, quite frankly.
And Kevin, I will take it one step further and say that it attracts the back office talent as well. I mean, that was one of the big reasons why I joined Piedmont 14 years ago. And one of the reasons I was able to attract talent into the organization. And I know other leaders were able to do the same because of the quality of the care, right? I still get my care there. My parents have gotten my care there. So I think, to your point, focusing on those key things that are really important at the end of the day, not only drives referral volume and doctors, but it drives talent in the people that want to work for those providers as well.
Right.
So as we're kind of nearing the end of our time today, I was curious if everybody could pull out their crystal ball and give me just a 30-second to a minute or two.
I have a magic 8-ball.
Oh, wow.
You better have one.
That's amazing. All right.
Kevin,
That's how all my decisions are made.
Yeah, I know. I totally missed the boat on that one. Yeah.
So no answering.
Did we downgrade the rating or not? Right, Kevin?
Yeah, exactly. Will there be downgrading?
I love it.
So Heather, we're going to start with you, and you can't reference a magic 8-ball response, but if you had to look forward 1 year and just say we're sitting here again next year, what are the things that you think are going to be broken and remended in the healthcare system? What are the things that are going to be different?
It's difficult for me to say exactly. Say this is going to be. I think that as a whole, healthcare is going to get better about infection control, right? We've learned that lesson. They weren't. There are hospitals that have been overrun with C. diff for years and nobody paid attention to it. Now COVID, all of a sudden, boom, like Kevin said, the hospital's the most sanitary place to be. That has not always been the case. So I think that's going to continue to improve. I think patients are going to get a lot more demanding of the financial aspect of they may follow their doctor, but if that doctor, if their office or their revenue cycle and all of that is a bad experience, they're going to let their doctor know a lot more than they would previously. I think that the physicians are going to start getting involved when their patients start getting compromised. And I think overall, I hate to even bring it up, but the crisis in Ukraine and everything that's going on, and we have yet to see what the total fallout is. We're only 13 days into it. It's a little bit like, 2 weeks to bend the curve. I hate to say it that way, but we're 2 weeks in. We don't know what's ahead of us. And so I think there's just a level of uncertainty that's throughout our country right now that I think a lot of people, when it comes to their healthcare, they're going to kind of own it and be more demanding of it. And they're going to want to know more certainly what they're up against. So that's my opinion. I could be wrong.
Well, there is definitely no way that came from the magic 8-ball. Thank you, Heather.
It was a little too verbose. Kevin.
I have never once met a leadership team at the places that we rate that doesn't say we can always do better. There was some philosopher whose name's eluding me. That's like, the being perfect means you're always trying to achieve perfections. You never stop that journey. And I think that's going to be the case going forward. I think overall we have to simplify things. I can remember again years ago doing these, flow charts on how to get crackers and a Coke to a patient. And, 74 steps later, you finally get the crackers and Coke. And the answer is just give them the crackers and the Coke. I mean, it's just that simple. So try not to overthink some of these things. They're a little bit obvious. But if I had to give you like a big, bold prediction, something that I think the industry needs, and Heather mentioned this too. So we need financially viable hospitals. Brian mentioned this too. They're the bedrock of our community often. And we learned through COVID, right, that not only do we want a great clinical hospital down the street that literally during COVID kept people alive, but if it's not financially viable, then they're not going to stay open to do that. And one of the things that we need to do is just increase those revenues, I think, across the board. We talk all the time about minimum wage and a living wage for our people. Let's move it up to $15 an hour, $20 an hour, whatever the number is. And I mentioned before that top line revenue, very predictable, but hard to increase. And do we get to some time where Medicare, Medicaid, the big insurers start to pony up a little bit more to say, we understand now that there are black swan events occurring all the time, and we need you. We want you to be, stable financially as well as obviously clinically. I don't know if it'll ever happen. If I was an insurer sitting here and say, I already get plenty, so I can't put that out there, but that's something I think that the sector needs to, let us relax and focus on what we do best, which is treating patients, treating people, keeping them healthy, keeping our community healthy, and not have to worry all of the time about that extra dollar that's there. And that's what we're doing right now. So that would be maybe my wish list versus my prediction.
Thanks, Kevin. That's fantastic. And since you don't have a magic 8 ball, I know that was all from your head and heart. Brian, what do you think? If you had to fast forward 12 months?
I think you're going to continue to see investments in alternate sites of care that people have not traditionally gone to get healthcare. And when I say beyond traditional healthcare, I think employers have really started to invest in mental health. If you look at, for example, Salesforce during the pandemic created a Be Well series. It was originally just for their employees, but if you actually go out to Salesforce and Be Well, you can actually watch these 30-minute vignettes of just people talking about the leadership or in personal well-being and just trying to help their employees through difficult times, because I think we've not paid enough attention in the mental wellness side. So that's one part. But I also think employers are going to begin to offer more healthcare services, whether that be employee-based clinics. I think they recognize people came to work sick a lot of times or with nagging injuries. I think you'll see factories and warehouse type environments where they may bring in physical therapy people on Tuesdays and Thursdays. And so they're actually able to treat their employees on site versus having to go off site for these kinds of things. So I think you're going to see, which to me will lead to more employer and provider partnerships and relationships, and potentially even more narrow networks, where you're going to see employers partnering with local providers to try to improve quality, both on site at their facilities, but also at the employer facilities. And as well as just other alternative means of care. So for example, my health insurance right now, through the individual plan that I have, they have a teledoc program. And it's not through any provider, it's through the health insurance company. So I think you're going to continue to see health insurance companies continue to invest time, money, and resources into providing alternate sites of care.
This has been absolutely fantastic. I've been taking a few little notes as we've gone through. And obviously, as Heather mentioned, for Epic River, we're hyper-focused on the community care aspect of things. We want to find a way to make healthcare affordable, which doesn't always mean charging less, but making it so people can pay for it. And as we went through, Kevin, you started us out by talking about how the pendulum has swung, and then it swung back and back again, and it's very likely to swing back as we go forward. And I do really look forward to seeing what things the healthcare is willing to break in order to save costs and interrupt that. We've always done it this way. As a software company, we love breaking things and moving forward as we do. So I'm very excited to see healthcare, taking that same approach, especially on the rev cycle side. It feels like clinical tends to move much faster on the innovative front than the rev cycle side does. And I am fascinated by the concept of how the high deductibles are seen. I think that was very astute, that of what it looks like to a finance professional inside of healthcare as deductibles keep going up and more people sign up for high deductibles. The tie-in with employers has always been fascinating to me. I've spoken with people in other countries and they're astounded at the fact that our company provides our healthcare. And it sounds like that may be deepening and changing in different ways as the year goes on. And we certainly look forward to building these community healthcare providers up and making sure they can stay viable. We've seen some situations, Heather, where you are in Georgia, where a community hospital goes and the community around it just slowly erodes. And keeping that from happening all over the country, I think, is really of vital importance. So this has been truly amazing. I've really enjoyed the conversation. And like Mark Twain said, if I was smarter, I would have talked less. But thank you all. This has been absolutely fantastic, and I really appreciate your time.